NHS England has told hospital trusts that they must only remove gas and air from maternity wards as a last resort. Several hospitals have temporarily suspended the use of gas and air following concerns that midwives and staff are being exposed to excess levels of nitrous oxide. Well, joining me now is the midwife and author Leah Hazard. Good morning to you, Leah. Can you explain to us why these dangerous levels would be happening in some hospitals and not in others?
Well, I think it really comes down to proper ventilation in certain units. In your average labour ward in the UK today, gas and air is used regularly, sometimes continuously throughout the day and night. And if there is inadequate ventilation within that room or within that unit, then levels of this gas can accumulate within the room. And we know now that the levels in some of these units where the gas has been withdrawn were very, very high, so as to potentially cause danger to the staff working there.
Yeah, I was just going to ask, how long has this problem of excess exposure been known about, and are there symptoms?
Well, we don't really know, to be honest, because I don't think, to my knowledge, hospitals have really been monitoring these levels consistently. And it's a shame because, midwives have already put up with a lot of airborne exposure of COVID during the pandemic. We've already been trying to raise our voices about adequate ventilation and safe working environments. So, unfortunately, perhaps not surprisingly, these levels of Entonox have now caused concern, whereas maybe this is an issue that could have been addressed if levels had been monitored more regularly.
Well, that's very interesting. I mean, you can understand why it would create panic, anxiety amongst pregnant women. What are the pain relief options if gas and air is not available?
Well, it will vary really from unit to unit, and it will vary obviously on the birthing person's choice, but there are other options such as TENS machines, water birth where that's appropriate, opioids such as pethidine and morphine, and epidural analgesia. So it would be great for hospitals to make women aware of all these other options, but obviously still really unfortunate that gas and air, which is very popular and effective, has been withdrawn.
So for women who are, 30 weeks plus pregnant, what sort of questions should they be asking of their hospital so that they're not negatively surprised or caught on the back foot?
I think the advice really is just to keep in touch with your local hospital where you plan to deliver, if indeed you do plan to deliver in hospital at all, and just try and clarify which measures, if any, they're taking to monitor gas and air levels. I know some hospitals have reported that they're using machines to kind of break down these harmful levels of the gas in the environment. Some units are actually working on their ventilation as well. But I think the situation is changing day to day, so best advice is just to stay in touch with the hospital.
OK, something else for pregnant women to be worried about. Leah Hazard, good to get your perspective on Sky News. Thank you.